Hello, I'm Jay Katz, Director of the Glaucoma Service at WillsEye Hospital, and I'd like to discuss with you open-angle glaucoma. There are different types of glaucoma that can be diagnosed. Open-angle glaucoma is one of those subtypes of glaucoma, and this is, in our country, the most common type of glaucoma that is identified. This is identified by one technique called gonioscopy. This is using an instrument in the office to look at where the fluid flows internally in the eye. If it appears that the fluid should flow through the natural drainage system of the eye, then that's termed an open angle. And if it's an open angle and the intraocular pressure in the eye is too high for that patient, then that is termed an open angle glaucoma. Many times there's no other associated abnormalities, and that's called a primary open-angle glaucoma. However, sometimes you can see some other differences in the eye. White material called exfoliation material, which sometimes deposits on the iris, on the pupil of the eye or the lens of the eye, and that's termed then an exfoliation glaucoma or a secondary open-angle glaucoma. Also, there are disturbances of pigment in the eye, giving pigment deposits on the cornea or lack of pigment in the iris that can be seen under a microscope, and that pattern has been called a pigmentary dispersion syndrome, which can lead to a pigmentary glaucoma or another type of secondary open-angle glaucoma. In these situations, the patients are all treated the same, meaning that we still lower intraocular pressure in all of them to a safer level. That can be accomplished with the use of medications, eye drops, and there are several different classes for that. If the eye drops are ineffective or not tolerated, or if the preference is not to be on medication, then laser trabeculoplasty can also be used to lower the intraocular pressure. And then finally, if all these measures fail, then glaucoma surgeries can be used to lower the intraocular pressure in open-angle glaucoma. In open-angle glaucoma, the problem is that the pressure, if it's elevated and causing damage to the eye, it can be identified by examination of the optic nerve, by directly looking at it, or by doing sophisticated testing like photography or image acquisition with machines like the optical coherence tomography unit. In addition, looking at the loss of vision on the side, which is typically where it first develops, can be identified by using visual field technology called perimetry. And that will also help establish whether there's been damage occurring in the eye. So between looking at the nerve and looking at the visual field test, one can show that there has been damage from the pressure. And the key to the therapy, all the therapies in lowering pressure, is to prevent further loss of vision, to stabilize the disease. The good news is that if you identify glaucoma early, open-angle glaucoma included, that the prognosis is quite good in stabilizing the disease and preventing further vision loss.